Welcome, everyone. Today, we are diving into one of the most fascinating topics in comparative anatomy, the mammalian cranial nerves. If you have ever wondered how your brain instantly knows the taste of your favorite food, or how you can blink in a fraction of a second, you are in the right place. We're going to explore not just the biology of these vital nerves, but also the physics of how they transmit signals so incredibly fast. Let us get started. To understand cranial nerves, imagine your body is a massive, complex office building. The brain is the CEO, sitting in the top floor executive suite, and the spinal cord is the main elevator shaft, carrying messages down to all the lower floors. However, the CEO also has a set of direct, private intercom lines that connect straight to the most important offices on the very same floor, like the security cameras of your eyes or the cafeteria of your mouth. In our bodies, these direct intercom lines are the cranial nerves. They bypass the spinal cord entirely, allowing the brain to communicate instantly and directly with the head, neck, and a few vital organs. Now that we understand what these direct lines do, let us look at how they are organized. In mammalian anatomy, cranial nerves are a set of exactly 12 paired nerves. Unlike spinal nerves that emerge from various segments of the spinal cord, these 12 pairs emerge directly from the brain and the brainstem. Anatomists traditionally designate them using Roman numerals from 1 to 12. This numbering is not random. It is based strictly on the order in which they emerge from the front of the brain all the way to the back. This evolutionary conservation highlights the basic wiring diagram of the vertebrate head. Knowing there are 12 pairs leads us to ask, what exactly do they do? These nerves fall into three functional categories. Some are strictly sensory, meaning they only carry information, like sight and smell, to the brain. For example, the optic nerve, known as cranial nerve 2, is purely sensory for vision. Others are strictly motor, controlling muscles like those moving the eyes or tongue. Finally, we have mixed nerves, which contain both sensory and motor fibers. The facial nerve, or cranial nerve 7, is a perfect example of a mixed nerve, as it controls facial expressions while also carrying taste sensations back to the brain. Before we move on to the physics of these nerves, let us see why they matter clinically. The importance of cranial nerves cannot be overstated. Doctors use the specific function of these nerves to pinpoint exactly where a brain injury or tumor might be located. If a patient cannot feel the left side of their face, a neurologist immediately knows to check the trigeminal nerve, or cranial nerve 5. Furthermore, the vagus nerve, or cranial nerve 10, is incredibly unique. It extends far beyond the head, acting as the primary parasympathetic control for the heart, lungs, and digestive tract. Without these precise pathways, basic survival would be impossible. Let us take a moment to visualize what we have just discussed. Here, you are looking at a ventral, or bottom-up view of a mammalian brain. Notice how the 12 pairs of cranial nerves emerge directly from the brain tissue and the brainstem, completely bypassing the spinal cord. The color coding here is key. The blue pathways represent purely sensory nerves, like the optic nerve at the front. The red pathways are motor nerves, and the purple ones, like the massive trigeminal nerve labeled as Roman numeral 5, are mixed nerves. You can clearly see the sequential ordering from 1 at the very front down to 12 at the base of the brainstem. Now that we have a clear picture of the anatomy, we must shift our perspective. While cranial nerves are biological structures, We must use physics and mathematics to truly understand how well they are functioning. When a doctor tests a cranial nerve, they measure how fast the electrical signal travels along the nerve fibers. This speed is known as the nerve conduction velocity, and it is a critical metric in neurobiology. By calculating this velocity, we can determine if the nerve is healthy or if its protective myelin sheath has been damaged by disease. A healthy nerve transmits signals incredibly fast, while a damaged nerve shows a dangerous delay. This brings us to the mathematical representation of nerve health. The relationship between the distance the signal travels, the time it takes, and the resulting velocity is a fundamental kinematic equation applied directly to living tissue. The formula is V equals D divided by T. Let us break down these symbols. The variable V represents the nerve conduction velocity, measured in meters per second. The variable D stands for the anatomical distance the electrical impulse travels along the cranial nerve, measured in meters. Finally, T represents the latency, or the time it takes for the signal to travel that distance, measured in seconds. If the distance remains constant, but the time increases, the velocity will decrease, which is a primary clinical indicator of nerve damage. Before we move on, let us see this formula in action with a concrete clinical example. A neurologist is testing a patient's trigeminal nerve. They place a stimulating electrode near the ear and a recording electrode on the jaw muscle. We are given that the anatomical distance between these points is 0.12 meters. When stimulated, it takes exactly 0.002 seconds for the signal to arrive. We need to find the velocity. We choose our kinematic formula, V equals D over T, because we have distance and time. Substituting our values, we divide 0.12 by 0.002. This yields a final conduction velocity of 60 meters per second. Because this falls perfectly within the healthy mammalian range of 50 to 60 meters per second, the doctor can confidently rule out demyelinating diseases. Now that we have successfully used the velocity formula, let us consider a different scenario. What if we already know the healthy velocity of a nerve, and we know the anatomical distance it covers, but we want to find out exactly how long a signal takes to reach its destination? This is especially important for cranial nerves that travel long distances, like the vagus nerve, which wanders all the way down to the heart. To find this biological time delay, we must algebraically rearrange our fundamental kinematic equation to solve for time instead of velocity. This leads us to the rearranged form of our equation. By multiplying both sides of our original equation by time and then dividing by velocity, we isolate the time variable. The new formula is T equals D divided by V. Conceptually, this tells us that the time delay is directly proportional to the distance and inversely proportional to the speed of the nerve. The variable T is the biological time delay in seconds. The variable D remains the anatomical distance in meters, and V is the known healthy conduction velocity in meters per second. If a nerve has to travel a very long distance, the time delay will naturally increase unless the nerve is highly myelinated to boost its velocity. Let us apply this rearranged formula to a fascinating real-world example. The vagus nerve regulates the resting heart rate. In a large mammal, like a horse, the distance from the brainstem to the cardiac pacemaker cells is approximately 1.5 meters. We are given that the vagus nerve in this horse has a known conduction velocity of 50 meters per second. We want to know exactly how long it takes for a calming signal from the brain to physically reach the heart. We use our rearranged formula, T equals D over V, We plug in 1.5 meters for the numerator and 50 meters per second for the denominator. Dividing these gives us 0.03 seconds, or 30 milliseconds. This incredibly rapid transmission perfectly demonstrates the reliability of mammalian cranial nerve pathways. We have covered a lot of ground today, so let us summarize the most important ideas. First, remember that mammals possess exactly 12 specialized pairs of cranial nerves that provide direct brain-to-body connections, completely bypassing the spinal cord. Second, these nerves handle everything from pure sensory input, like vision, to complex mixed functions, like facial movement and heart rate regulation. Finally, we learned that we can quantify the health of these nerves using the kinematic equation for nerve conduction velocity. A high velocity proves that the protective myelin sheath is intact and functioning perfectly. You now have a solid foundation in both the anatomy and the physics of mammalian cranial nerves. Excellent work today.